Hi, I'm Dr. Surindher. I'm the director of Cosmosis India. We are an aesthetic surgery and aesthetics clinic in the heart of Bangalore in Brigade Road. Many people complain of problems with the lip size. They feel either the lower lip is too big or when they are talking it's causing them problems, and it is often noticed by other people rather than the patient themselves, and because of they ask you to. So this is not a very uncommon problem. We have patients who keep asking us why. A few reasons could be attributed to it. One is, most commonly what happens is the people who have a larger lip tend to have a problem with the dryness of the lip and they are biting them. So that also adds to the issue, and that is what causes more irritation, and then it becomes a habit. So secondly is that some people have an inborn problem where the lip is a little larger or it is turned outwards. So what happens is the inner mucosa, which normally, or the lining of the lip, which normally has to be wet, is now exposed and gets dry. Because it gets dry, you tend to bite on it, and that also adds to the problem. So when you have such a problem, what are the options for it? The only option is to surgically reduce it. Surgery is done from inside the mouth. There is no scars on the outside, and it's done inside of the mouth, where we remove a part of the mucosa, which is the lining of the lip, and then we remove a part of the muscle, and then we stitch it up so that the lip is rolled inwards, and that's when it brings the dry mucosa out and brings the wet mucosa back in, and because of which your irritation and problems will reduce, and of course it reduces the size. There is also always a limit to which you would want to reduce, because a very thin lip gives you a very mean look. So we don't want to do that. So what we do is we try and reduce it by grades, and then we try not to overdo it. If you always need to do some more, you can go in and do it, but if you remove a lot of lip, then you cannot recreate or add more lip tissue there. So it is always better to do a conservative reduction of the lip rather than a aggressive reduction, because if the problem is, if it becomes too thin, it gives you a very mean look, and secondly, if it becomes too thin, you might have problems with closing of the mouth and speech. So always be conservative when you're doing a lip reduction. The procedure itself is usually done under local anesthesia. The stitches are out after a week, and the complete healing takes you anywhere between 6 to 8 weeks for things to become normal and the lip to become soft. And depending on where it is done and who's doing it, the cost can range anywhere from about to 15,000 upwards if you're doing both the lips. The upper lip and the lower lip both can be done depending on what the problem is. We have to identify the problem and do as is required for the patients.